Okay, hi, it's Dr. Buford. We're just getting started on your left shoulder. We're looking in from the back to the front. There's a blue cannula coming through a part of the shoulder called the rotator interval. As we look over here to the right, there's a biceps tendon running up towards 12 o'clock. The biceps tendon normally inserts into the labrum and part of the shoulder called the supraglenoid tubercle, and this is what's torn and loose, in your shoulder. And so we know that it's some variant of a pathology here because this is loose. See that? That's not supposed to do that. That's supposed to be anchored down here to the cartilage. And you can see it's almost completely ripped. Now, what's interesting about your anatomy is something that we've seen before where you've got this ligament coming across and it's inserting, everything's coming together right about here at the tip of the probe. The biceps comes down and is inserting here, and this middle glenohumeral ligament is coming across the subscap tendon and inserting basically right at the same place. And so potentially that may be why there's a lot of extra stress right in this area. You also don't really have any labrum from here to here. Okay, you have some labrum down below. It's torn, but you do have some labrum down below here, but there's no labrum here. So this combination of things is what we called the Buford complex many, many years ago. And so you do have it, and that's an interesting finding. We're gonna fix you up, obviously, but that's one of the reasons why you've been having pain, because when you have the biceps tendon and this ligament both pulling on this loose area, you can see what happens. Things start to tear and break down. Your rotator cuff looked okay on your MRI scan, and at least from this articular side, this rotator cuff looks great. That's the supraspinatus part of the cuff, and it normally inserts right at the edge of the articular margin right along here. This is articular cartilage down here. This is cuff tissue here, and that looks great. So I think the main issue at this point is this biceps tendon / Buford complex laxity. You have a little bit of labral fraying all the way around, but I think the main source of your symptoms at this point is right in here. Now this is loose enough that we probably ought to plan on anchoring down the labrum, because if we just cut this, this is all going to be loose and the middle glenohumeral ligament's not going to be attached to anything. So we'll get to work on that in just a minute. Hold on one second. Was that paused? Okay, one second. So one of the first things we can do here, hold the camera right here, Preston, is we can start to take off some of the cartilage here, because we're going to anchor this labrum down. And with the shaver, we can start to slowly just remove some of the cartilage, and that's what we're doing here. We're going to go ahead and remove enough cartilage where we can see the bone. Push in, straight in. Thanks. And we do this because for the most part this labrum won't heal back to the cartilage. We have to expose a little bit of bone to get the best healing. Pause. Okay, so let me just show you what we've done so far. We've taken off some of the cartilage using a shaver. Okay, and so there we have exposed bone there. And now when we put that tissue back, that ought to heal. We've been looking at the biceps, looking for any signs of biceps tearing, and I'll tell you, your biceps looks great. There's really no tearing in the biceps at all. If there was, I would do a tenodesis for sure. But now I've got a decision to make, because your biceps here looks completely normal, and the problem is really just where this tissue is loose. And so we may have a solution that doesn't necessarily require a biceps tenodesis. I'm going to place another cannula, and that's what I'm using this spinal needle for, just to kind of get my angle. We're going to go a little bit more superior. Okay, and so that should give me a good angle down into the bone there. So we'll get organized here and show you some more in a minute. Okay, so we've got our second cannula in. I'm actually going to manipulate it and move it on the other side of the biceps here. because it's going to give me a little better angle. So there it is on the other side of the biceps now. And now with this guide, we're going to place an anchor. First I want to see where it sits. Yeah, so we're going to place an anchor right about here down into the bone. But again, I want to make sure we do this in an anatomic position. So that's what we're checking here. So we'll start right about here. Pause. Okay, so we've got a double loaded anchor down, and it's real strong. I'm pulling on, if I be still for a minute, when I pull on the anchor, on the sutures rather, you can watch the whole screen move because I'm pulling your whole shoulder. So that's how strong that is, and that's plenty of strength to repair. I'm going to get some of these sutures out of the way, just like that. I'm going to pull one back just for a minute. Okay, and so now we've got these three sutures out of the way. I'm going to go ahead and just show you the safest way to do this. Hold the camera there. Switching stick, please. Which is to take these three sutures outside the cannula. And then I'll need the cannulated inserter. Okay. So now we're organized where those sutures are outside the cannula, so that way we can work inside the cannula without any twists. And so next we'll go ahead and take a crochet hook, and take this one blue suture that we're going to work with first so that it's inside the cannula. See how that's organized there? And next we'll go ahead and pass a stitch way back here. We'll show you that in a minute. Okay, so now we're just going to pull the relay, and as we do that, you can see how it brings that blue suture back behind, grasper, and out this posterior cannula. We'll go ahead and grab it and pull it all the way out. So now we've got a stitch behind. The next step is to get the partner suture. This is why these anchors are always kind of color-coded in terms of the sutures. Okay, and so there's the other one. Okay, and so now we're going to tie a knot right here, and that's going to hold that part down. Pause. Okay, so a couple things. We've tied that first knot. It's very strong, and it's interesting. You can really see that just tying that has put a lot more tension on this middle glenohumeral ligament, which is right below the blue cannula. See how that's much tighter now that we have an anchor point that we didn't have before. But we're not quite done. We're going to place this blue and white stripe suture. I'm actually going to place it right next to the biceps. I don't want to capture anything and limit your motion, but I still think we need something else to anchor this down right here. And then we'll have to decide if we need to put another suture anchor back here. We haven't looked from the front to the back yet, but we're off to a good start. Pause. Okay, so here's our suture hook. You can see I don't really want to go through the base of the biceps, and I really don't want to be way over here because I think that would capture the middle glenohumeral ligament. So I'm trying to plan a stitch that takes me right about here without capturing the biceps. We'll get this organized. Pause. Okay, so here's what we've done. I tried to place this suture, like I said, right at the base of the biceps. The biceps still has plenty of excursion, as you see here. I don't think I've captured the biceps at all, but I really did not want to capture the middle glenohumeral ligament, and so I'm happy that this suture is a little bit more to the right. I don't want to close down this space right here. I think that leads to tightness and stiffness and loss of external rotation if we do that, and so I'm happy with that stitch. Now what I need to decide, as we look in the shoulder, you can see I'm a little concerned about this labrum back here, so we're going to put the camera in the front in just a minute and have a look from the front to the back. So I'm going to put this cannula over here, and we're going to switch out the scope. We're going to put a switching stick in the front, and the scope is going to go where this switching stick is. Pause. Okay, so now we're looking from the front to the back. Here's the anterior labrum, and it's a little bit frayed, but we can deal with that. You did not have any anterior instability. But what I'm concerned about is this posterior labrum right here. And it looks like this kind of slap lesion extended back quite a bit. You can see there's signs of injury to the cartilage here. And so I do think we're going to have to place an anchor here. I'm going to show you something here first, though. That's our most posterior anchor for the slap repair. And I think we're going to have to place another anchor, just kind of splitting the difference to make sure that we have this labrum secured for you. And so you can see how that's a little bit unstable there. And I think I'd feel better if we just had that secured, given that we're here doing all this other work. Okay, so we've got that. I just want to show you the spacing between the posterior suture for the slap lesion, and then there's another suture holding down the posterior labrum. I think that's all we have to do. We've already prepared everything, so that ought to provide a little security for the labrum. We've debrided the front, as you see there. We don't want to do any significant tightening surgery because I don't want you to get stiff, but we also want to give you a chance to get back to doing everything you want to do without pain. So I'm going to go ahead and look in the subacromial space because you've also had some impingement type symptoms, and we'll have a look at the ligament and decide if we have to do anything there. Okay, so we're doing a little bit of a decompression. We're up above the rotator cuff, so we're outside the joint now. I'm just turning on a little bit of suction so we can get a little clearer picture for you. And what we're seeing here is we've been working on the bone back here. And now we're up to the front, or the anterior portion of the acromion. That's your clavicle. And so we're just going to start here. We'll back up this blue cannula a little bit. That's in the front of the shoulder. And we're just going to take off this last little bit of acromion that's hanging down here. We make sure we get all the way out laterally as well. And that looks pretty good. So now you can see there's a lot of room for the rotator cuff. The blue cannula is not restricted at all. Okay, the rotator cuff is down below here. And so this, as I rotate your shoulder, you'll see the rotator cuff rotate. So there's rotator cuff. I don't see any signs of any holes or problems on this side of your shoulder. That's full external rotation. There's an internal rotation. So I think we're just about done. We're going to look at the clavicle here next and make sure there's no spurs or anything underneath it. And that's this bone right here. We're going to rotate the camera. And so there's a little bit of a spike there. See that? And so we'll take that off. And again, this is all designed to keep anything from rubbing on the rotator cuff. And that's pretty much it, okay? You did not have any pain at the AC joint, so I don't think we need to do a complete distal clavicle excision. We just want to make sure there's nothing hanging on the cuff down below. Okay, so good luck to you now. We're going to have one more look around, but I think this will be the end of the video. Bye-bye. Shaver one more time.